Hello, this is Dr. Hauk, and this is the shortest lecture I can make on the mechanics of pelvic drop, hip abduction, internal rotation to try to motivate training programs. So we can see this pattern here in a person landing from a drop jump. You can see the box in the background. She's jumped down. We can see this hip adduction, internal rotation, which leads to this kind of apparent valgus. And you might even have like a pelvic drop on the other side, as in running. And so we want to ask the question, either in a single leg stance or double leg land like this, what muscles actually correct this position? So here's a summary of muscles that might possibly level the pelvis and move the hip into abduction and external rotation. So we know that gluteus medius is hip abduction and is best mechanical advantage at neutral hip position. Gluteus minimus is hip abduction and flexion, and does better in a neutral hip position. So we can see from the posture of the person in the land that the optimal position, neutral, is not where the person's at. So we need a different muscle possibly. And so this, kind of led to this focus on the gluteus maximus, which you can see really does hip extension, abduction, and external rotation. And there's this idea that it may work better at 45 degrees of hip flexion, which would be ideal in the posture we saw that person landing at. And so that may be the muscle that we need to kind of pull that knee into an apparent neutral position out of that medial knee position. And then we'd have the hamstrings kind of working better at 0 than 45, and we're going to examine this in a minute. So here's a study that was done by Chris Powers, and a lot of this lecture, it comes from his work. So almost all of these papers are from his work at USC. And so in this particular example, he was comparing our study. He compared like our traditional kind of hip abduction position with the pelvis vertical and the alignment of the hip ideal for the gluteus medius muscle. And then in comparison to this kind of strap with a forced transducer in it where the people had to kind of push out. So this kind of idea of abducting and externally rotating their limb alignment at the hip when in a weight-bearing position. And so we could see is this is the EMG pattern when they're in this kind of standing position, abducting and externally rotating, very similar to that landing pattern we saw at the beginning of our first slide. And we can see the glute max here in blue, the med here in orange, and the tensor fascia lata in green, and 100% is the normalized muscle activation on the Y. And we can see that the highest EMG drive is to the glute maximus, not the glute med, in this hip flexed, slightly forward bent trunk position. Now, what that doesn't tell us, though, is tells us the motor activation, but doesn't tell us the effective length and moment arms on the actual torque that's produced by that muscle. So in this subsequent study, also done by a Chris Powers group in the last year or two, they compared the contributions of the hamstrings and glute max muscles in these 4 different positions. Okay, and so I've kind of matched up the different positions here based on length. So we can kind of see this hip flexed, knee extended position, and in this position both the hamstrings and the glute max are lengthened, and so that would affect their overall ability to contribute to the moment. Okay, and then we also can see in this position C down here is that this position is really kind of the neutral kind of reference position where both the hamstrings and the glute max are neutral, and that would give them a good position theoretically anyway to contribute to the moment of the hip joint. And so here we have in B, now it's been changed, so now the hip is flexed again, but the knee is also flexed. So the hamstring is lengthened at the hip but shortened at the knee, so maybe just relatively very little change in length from neutral. but the hip is flexed, so it's lengthened. So this could affect its contribution to the force output or the moment at that particular joint. And then in D, we can see that the knee is flexed and the hip's in neutral, so the glute max is in neutral, so it's not lengthened or shortened that much, and the hamstring is very shortened. Okay, and so what it turns out to be true when we kind of put the different people in these positions and create similar torques at each position, the contribution of the muscles really varies, and it's varying based on the moment arms and length. And the key thing to remember, and is important for this discussion, is essentially this activity here really activates the glute max much more, and then the hamstrings in terms of hip extension. So this position really relies a lot more in terms of the contribution to the moment to be involve the glute maximus muscle, where at 0 degrees, this position, this is almost all hamstrings. And so this kind of helps us in two ways. It says, well, like, hey, when they're landing from a knee bent position, really they're not going to be able to rely much on the hamstrings for hip extension. And really when the foot's out straight, like in the initial contact from running or walking, really it's all about the hamstrings, not the glutes. Okay. And then this position down here is the most effective position at isolating the glute maximus muscle and kind of preventing contribution to torque development from the hamstring muscle. So these are really all applicable to training paradigms. So now we're going to talk about how we started this lecture on running. And we're going to revisit this again. Same kind of diagram. We're looking here now at actual data from a patient landing. And this, again, is from Dr. Power's 2010 study on control of the hip and knee during this kind of drop landing task. And notice a couple different things. So let's start with when the trunk's vertical. So we have in B a vertical trunk. And then in A, we have a very forward bent trunk. And we can see the position of the limbs and the joint centers with the dots here, and then the yellow line is the ground reaction force. So we'll put V, GFR, GRF, and it's really just the vertical ground reaction force, from what I could tell. Okay, so if we look at this, we can kind of look at the moments here that are being generated in each different position. So the person's landing from a box vertical jump, so about the same height and everything, but the pattern, that the movement pattern itself is changing the torques at the knee and the hip, and not really very much at the ankle. So we kind of notice that the ground reaction force goes right through the joint center at both of them. So the ankle is kind of not really, there's not much going on, not much load, right? But if we look at the difference that the trunk makes at the hip and knee, it's pretty dramatic. So we can start in the vertical position, and we can say, okay, here's the distance of the ground reaction force from the hip joint center. So that is flexing the hip joint, so the internal moment at the hip is an extension. So these are all internal moments. And then if we look at the moment here at the knee, we're like, wow, that's a big moment arm, much bigger than at the hip. And the external moment is flexion, so the internal moment is extension. So we go to the knee, and then we have this kind of external extension moment. But we can also notice that this one is, in this particular case, it's bigger, so we have a bigger load, okay, at the hip than the knee. I'm sorry, that wrong. At the knee than the hip. So for this vertical one, we could say that the knee load is greater than the hip. Okay, so we go over here to the forward bent position, and look what's happening right here. We have the moment arm here at the hip. It's the same. It's causing an external flexion moment, so we need an extension for internal moment to counter that. And then at the knee, it's still behind the knee, but it's much, much smaller, right? So it's flexing the knee, so our internal moment has to be an extension. But in this case, the knee moment is much less than the hip. Okay, and again, the ankle moment is going through there, so it's not much is going on. All right, so what we can kind of see is trunk position basically influences whether the hip or the knee will be required to like create a bigger moment in terms of the movement. So we want to shift control or give more emphasis in terms of the work that's being done during the movement to the hip. We would have them flex. If we wanted to shift control and have more movement or more load be distributed to the knee, we would have the trunk more vertical. Okay, so that's an important aspect of training, and this is also going to relate to whether it's the same principles applied if you're stepping down or stepping up, if you're doing a squat, a single leg or a double leg squat. If you bend forward during the double leg squat, at the trunk you're going to load your hip more than the knee. So how does this relate to running and other tasks? Well, so we'll just start with running in the sagittal plane. Here we see a runner that's been asked to kind of lean back, run at their natural trunk position, and then lean forward. And what we can kind of see is that essentially it's going to load when they're kind of more vertical, as in A. Essentially what we're kind of seeing is the body center of mass at this point is going to be more posterior, okay, to the knee. It's going to be closer to the hip joint center, so there's going to be greater load at the knee. Here's the self-selected position, and we can see it's just slightly more forward. Then here's the more forward position. So now we can see the person's trunk center mass is anterior. So now the ground reaction force is going to be passing more closely to the knee joint center. Okay, as it passes more closely to the knee joint center, at the moment being generated, or the demands on the quadriceps are going to decrease. So vertical trunk, more demand on the knee, less on the hip. A forward bent trunk, more demand on the hip, less at the knee. Okay, and so that basic principle is going to get us to focus in on, changing the mechanical technique or the landing pattern of the person to try to correct this pelvic drop in hip adduction and internal rotation position that people are adopting during different running and landing patterns and even just sports movements. And so this is kind of how the different options for the ground reaction force in terms of landing. And here's kind of a typical standard example in A, and where we can see the skeleton, and then we can kind of see the moment being generated at the knee by the ground reaction force. So this is kind of our reference value, this A. This might be the ideal, right? And then here there's like too much medial. So this is the person kind of moving toward their left side in this case. That would kind of create this larger than normal moment toward adduction, and then that would be generated, right? But that's not the typical pattern. This C is what we're really focused on. This is where we see this kind of rotated pelvic position. Okay, in this case, it's not a drop. It's actually a lean toward the right leg. And so there's a lateral right lean, and then we can see the adduction and internal rotation occurring, or this kind of apparent valgus at the knee. And this is where the ground reaction force is lateral to the knee. And so this is a real, kind of loading pattern that we want to try to avoid, that we think is either associated with injury or at least poor performance. Okay, so what does all this do for us in terms of training? Because this is talking about training, not biomechanics. And so the first part is, if we want people to land straight like this, they have to have an adequate quad strength to handle that kind of sagittal plane knee extension load, and we need them to have it at both, the strength to have it at both the hip and the knee, right? Okay, so if we want to avoid this position on the left and kind of get them to do this position on the right, on my right and your left, what we want to do is we want to give them adequate knee extension strength, and then we also have to train their glutes, and this is in particular glute max, to kind of recruit the muscle pattern, the muscle torque, that means EMG and mechanical advantage, to move this knee into a lot more lateral position. Okay, and so to do that, the movement pattern that might be required is, instead of and a rect trunk is a more forward bent trunk. And again, it doesn't have to be forward bent very much to start to have a more powerful effect on the mechanical advantage of the muscle. So it's not exactly the recruitment, but the length and also the moment arm of the muscle is facilitated when the trunk is bent forward. And the muscle we're talking about here is the glute maximus. So a slight forward bend can have a very strong effect on the ability of the glute maximus to reposition the knee in a more lateral position. And the other part, as we talked about last time, is just changing the overstriding, so the actual challenge to the system. So in other words, the ability of the the amount of driving torque, external driving torque of the ground reaction force to drive the knee immediately is less if we change overstriding. So these two strategies are effective during running, during different kinds of step-ups and different tasks that we're having people do, and so it generalizes to other things as well. Okay, but this key element is that forward trunk lean is linked to facilitating the glute max to make it stronger mechanically, and then it also has to have capacity, so it has to have the right kind of strength in order to implement that. So we need to kind of, in training, we need to kind of pair those two things. And then if the trunk's really involved in the leaning and stability issues, then essentially we're going to work on core stability, and then it really can't be overemphasized how important specific sports activities are. So we can kind of see this different grading now of a single leg squat that's been just recently published as a way to kind of objectify this. And so you can kind of see the criteria here and how to apply it. But if you're seeing a lot of different kinds of trunk movement, well, that might be indicating to you to look at core stability. If you're seeing the pelvic drop, the other thing you might want to look at, pelvic drop, which is this kind of number 2, and then also this hip position and external adduction and internal rotation, and this kind of creates this knee valgus. Well, then you would want to look at the knee extension strength and hip abductors separately, and then also in particular hip extension. And that's what this discussion gives you a rationale for. And the deeper they do the squat, then the more you're kind of isolating the effect of the glute maximus muscle. Okay, that's good. And then now we go to single leg step down. So this, I find this to be very effective in terms of revealing kind of movement deficits that I can see and observe because the movement's quite slow. It's also evident to people who are rehabbing when they're trying to do a step down. It's a good way to get them to be aware of how difficult it is. This 8-inch step seems to be at a sweet spot in terms of not too difficult, but difficult enough that people feel challenged and they can self-aware or self-observe these kind of trunk leans, internal or medial movement of the knee and the stretching in their calf or whatever's kind of contributing to their inability to kind of keep the knee in a stable position. So I really like this one, but if it's not effective, then we kind of do what you guys did in class, and you just start from a seated position and have them do a single leg stand from a seated position. That tends to reveal different kinds of deficits if these other two tests do not. Cool. Okay, here's a nice training program that you could use in your exercise instructions or as an option. This is basically taking 3 exercises from the FIFA 11, and I'll let you kind of look at those, and then looking at the effects of those on landing mechanics. And essentially, the result was, you can kind of see here, they had people that really had this kind of medial collapse of the knee. And then here's their kind of post-kinematic data, and this is after an 8-week training program. And it does make some sense because when you look at their FIFA 11 programs, it involved the hip extensors and the hamstring muscles as well as the hip abductors. So it wasn't really just a core program, it was really proximal control, including the core. And then here's a nice look at pre-post program. and you can kind of see the key elements here of this kind of injury prevention program, and they're kind of pre-post kinematic data. And this was a much larger study that was done in kind of integrating this different program in kind of normal exercise for athletes.